inside or the outside? That, okay.
Imaginary line. Okay? Alright. Now what I want to do is I want to put these about where they need to be. And I don't know if you can see that these black knobs are in my way, and I won't get that over. So I come back behind it. That's probably the easiest way to move those if you have to. Most of the time you can slide these. That's mid-calf, above the knee, and above the fracture site, below the fracture site, and this is where it needs to be. You can open these up if you like, and probably should. I should let me retract that. Open them up, because what's going to happen in a minute is you're going to lay the leg in there, and then you have to go fishing behind the leg for them. Okay. All right. So I've got these in the right position, and so I was over there. Now I moved over here. Okay. Now, before Jason can do anything, rescuer, pulling traction, before they can do anything, I have to stabilize the fracture site. And when we say stabilize, that means one hand above the fracture site and one below. And all you're really trying to do is, this muscle group's going to spasm, okay? Just keep that leg from moving, is all you're going to do, right? Now, and I'm just going to show her everything. And that way you can do it.
I have a question. Can you always tell exactly where the fracture site is? And so should you not use this if you don't know exactly where it is?
No, you better use this. As long as a fracture is not within the joint capsule. That's all. That's the only parameter there is. Okay? Now, imagine Jason's securing a pub below the fracture site, okay? Now what I want to do is, would I cut his pants off, or at least cut up and down? Yes. And would I cut the shoelaces? Sure. Whatever I got to do. But I'm just going to be gentle because I don't want to cut his shoelaces. And you notice that I'm going to try and be gentle the whole time. Okay? Supporting behind the ankle. Okay. Now, if you have to cut off a sock, if he's got long socks, probably the best way to do is pull this up, clip that, make a hole, and then just run your scissors down the side. That's a pretty easy way to do that.
I'm not sure you want to do that.
Huh?
Be careful.
Woo! Okay.
That's a fine specimen.
Okay. Now,
It's only got 3 toes.
now what you want to do, it's got wolf hair. Okay. Now what you want to do is you want to check pulse. Now where do you check for pulses? Right here. And by the way, when you do this, if you'd like to wear gloves, you're welcome to. But I really want you to try and find those pulses. Because if you ever really need to find one, and you go, or if you get the ER doc says, go find me a pulse on top of this foot, and you're going, okay. And he's going to call you a DA, okay? And that doesn't mean district attorney, okay? So find the pulses.
We were talking
And
about
generally-
the other day not knowing exactly where to.
So I'm going to show you right now. I feel the pulsing right there. And normally what I do, when I find a pulse, is I make a little X right there. Especially if I've got an orthopedic injury and I want to check that, or I need to check that by Doppler. Okay? There's pulses. Wiggle your toes, partner. And you feel me touching you?
Yep.
Okay. Now what I want to do is put the ankle hitch on.